Hi, my name's Victoria. I'm going to be your student nurse today. Can I have you state your name and your date of birth for me?
John Smith, 4/4/2004.
All right, so on your chart it does say John Smith, date of birth is 4/4/2004. So today we are just going to be doing some medications for you. So the first one that we have is lithium, and this is used to treat mania, which is part of your bipolar. And it's going to be 300 milligrams. It's one tablet, and you're going to take that once a day. And it is going to take 1 to 3 weeks to reach its therapeutic effect. So don't stop taking the medication at all. Some ADRs that you should look out for, and ADR stands for side effects, is some restlessness, mild thirst, dizziness, a loss of appetite, itching, depression, and a rash. So do you have any questions before I go ahead and give that to you?
No.
No? All right. So I'm just going to go ahead and scan your armband. Beep. All right. And then I'm going to go ahead and scan the lithium. Beep. All right. And the dose says lithium 300 milligrams by mouth, and on the chart it says lithium 300 milligrams by mouth. All right. So here is your pill and some water.
Thank you.
All right, so the next medication that you're going to be taking is called risperidone, and this is used to treat schizophrenia, bipolar disease, and acute outbursts of mania. Now, this is going to take 4 to 6 weeks to reach its therapeutic effect, which is a little bit longer than the previous drug that we gave you, but still don't stop taking this medication. And some side effects to look out for is going to be rash, a weight increase, aggressive behavior, agitation, anxiety, changes in vision, and inability to move your eyes. Do you have any questions about it?
Why do I have to take this if I don't have schizophrenia?
So the reason that you're taking this is because it also treats bipolar disorder. So some medications can treat multiple diagnoses at one time, but since you do have bipolar, that is why you're getting it. Okay. So I'm just going to go ahead and scan this medication. Beep. All right. So your medication is risperidone, 5 milligrams by mouth, and you are going to take this 2 times a day. And on the chart it says risperidone, 5 milligrams by mouth. So here you go, and you can drink that with water. All right, so the last drug that we're going to go ahead and give you, it's called lorazepam, and this is used to treat anxiety and anxiety associated with depression. So this is very quick acting. It takes about 1 to 1.5 hours to reach its therapeutic effect. Some side effects that you're going to notice with this is going to be some dizziness, sedation, unsteadiness, and delirium. So do you have any questions about that?
I don't have anxiety.
Well, so with your bipolar disorder, you have mania, which is one part of it, and then you also have depression, which is another aspect of bipolar disorder. Anxiety associated with depression is going to be used to treat the depression part of your bipolar disorder. All right, so I'm just going to go ahead and scan your medication. Beep. All right, so your medication is lorazepam, 1 milligram by mouth, and on your chart it says lorazepam 1 milligram by mouth. So you can go ahead and take this.
Thanks.
That was a good catch. So I have these papers for you. It just has a little bit more information on all the drugs that I gave you today. So if you would like to go ahead and go and review them, if you have any questions, of course, just get one of the nurses or anybody that you see, and we can go ahead and answer your questions for you.
Study up.
All right. Do you have any more questions for me?
Can I leave now?
You are good to go. The last drug that we're going to go ahead and an anxiety associated.
I'm trying not to look at you.
1 milligram by mouth. Oh, that's a good one. Anxiety associated.
I'm so sorry. Yeah, that's all.
I can give you is lorazepam. And and this is used.
Alright, we need to take.